Welcome back to another CANVax webinar. We have been hosting these webinars since fall of 2019 to help support public health professionals working in various levels of immunization. To learn more, please visit our website at canvax.ca/webinars as indicated in the link you see on the screen. Today's webinar, Building Vaccine Confidence and Demand in a Digital Age, is brought to you by the Canadian Public Health Association, CPHA, through the CANVax project. I'm Antonella Pucci, Manager of Immunization Initiatives at CPHA, and I will be moderating this webinar. Before we begin, we want to acknowledge that CPHA's office is situated on the ancestral and unceded territory of the Algonquin Anishinaabe people. They have been the guardians of this land for millennia, and we are grateful for the example their stewardship provides. CPHA is committed to working with all First Nations, Inuit, and Métis peoples and their governments in realizing meaningful truth and reconciliation. As for a bit of housekeeping, it should be noted that all attendees are muted. For this webinar, we will be using the Q&A feature to ask questions to our presenters at the end of their presentation. So if you have any questions, please type them in the Q&A box at any point during the webinar. When asking a question to the presenter, the question is first read out loud, answered live by the presenter, and then posted in the all questions section. If you have any questions regarding technical difficulties, please contact canvax@cpha.ca and we will reply to you as soon as we can. If multiple people are experiencing the same problem, we'll address it live via a broadcast message in the chat. Finally, here are some quick notes before we start. This webinar is being recorded and will be made available on CPHA's YouTube channel and on canvax.ca. Presentation slides will also be shared. Second, we invite you to take a short 5-minute post-evaluation survey at the end of this presentation to provide your feedback in the delivery of this webinar. And finally, if you haven't already registered with CANVax or subscribed to our newsletter, visit canvax.ca today to do so. So with that, let's begin. We have the pleasure of welcoming our speaker today, Renata E. Mars. Renata is an adaptation and public health consultant with 15 years of infectious disease expertise as a public health nurse and a researcher across Canada and the Southern Hemisphere. She is certified in infodemic management at the WHO and has supported their work in training healthcare providers. She teaches public health and global and Indigenous health policy and practices as a sessional nurse educator in Canada. She is also a research assistant with the EU-funded project JitsuVax, which focuses on investigating misinformation around vaccines, which may lead to people being less likely to accept vaccination. And it also focuses on testing ways of combating this misinformation and helping healthcare providers to communicate with their patients. Finally, Renata is the founder of Adaptable Folks, which is a healthcare and education consulting agency grounded in evidence-based innovation. So with that, I'd like to turn it over to Renata.
Fantastic. Thank you so much for welcoming me and for this introduction. And I'm really grateful for everyone to attend today's session. This will be more of a course overview of the Building Vaccine Confidence and Demand in a Digital Information Age. And so with that, if I can share my screen. And just a quick introduction. So my name is Renata Mars. My pronouns are she and her, and my life experiences shape my work in public health. I was a refugee from Romania as a child. My mother tongue is Hungarian. I'm an immigrant and settler to Guelph, Ontario, Canada, which is situated on Treaty 3 territory, Mississauga of the Credit First Nation of the Anishinaabe people. I have worked in public health for over 15 years. As a nurse, lecturer, researcher, and policy analyst. I have lived across 4 continents and visited nearly 30 countries where I collected cultures and stories during my time. So in order to see who is with us today, now that you learned a bit about me, let's learn a bit about who's in the audience today. So let me just stop sharing. And switch to Slido. So what you can do is, if hopefully you're watching this from a desktop, you can go to slido.com and enter this number that you see here in order to answer a bit about yourself. Tell us about your current role, whether it's in public health or outside of public health. just to see who's attending today. And there's about 65 of us. So let's hope that we get some responses. Promoter, awesome. Thank you for your response. A nurse, welcome, fellow nurses. A public health nurse, physician, fantastic. We'll keep going for a few more seconds. Student director, welcome. Academics, fantastic. This is very exciting to see. Administration, programmer, oh, fantastic. Okay, it looks like most of us are in the nursing bucket. This is great. This is great. And it just demonstrates that, in fact, infodemic management, whether in vaccine programming or beyond, requires a transdisciplinary approach. So I'm really grateful to see this many of you attending today. So I'm just going to stop sharing again and go back to my slides. Okay, fantastic. So thank you for that. And before I continue, I do need to give 3 very special thanks. One to CANVax at CPHA for seeing value in developing the course I'll be presenting today. Vaccine Demand Hub for delivering the global comprehensive course where vaccine programming and infodemic management was first combined and introduced through funding of Gavi, WHO, UNICEF, and US CDC collaboration. And of course, a very special thanks to the WHO infodemic team, Tina Pernat, Tim Nguyen, and Sylvie Bryand for their mentorship and leadership and dedicated global leadership and agile capacity building, utilizing the latest tools and stunning graphics, which you will experience in this presentation. So how do you find the course that I'm about to present to you? So you should see at the top of the slide, learning.cpha.ca, where you will have to create a free profile. And once you log in, then you'll have access to see many of the courses CPHA offers. Under immunization, you should find Building Vaccine Confidence and Demand in a Digital Age. It should look something like this. And so once you enroll in the course, you should see a nice outline of the various course contents and modules. So there's about 7 modules in total, including a pre-course questionnaire and a post-course questionnaire. And you have to complete all of these sections before you can get your certificate of completion, which is, I hope, is exciting for everyone to do so. Now, the courses are content heavy, and they were built fast to be the first, to be right, and to be credible, which you'll see is an approach to addressing mis and disinformation, but they can be iterated, and with time, they could be built into more depths. But for now, it's good to just have all information on the Canadian vaccine and immunization system in one place. And so, yeah, the certification is there. Okay, one more Slido, just because I teach 2nd and 3rd year students who love interactive slides. So there we go. Okay, so what drew you to today's webinar? And I'm interested to understand before we dive into infodemic. And I'll say infodemic probably 100 times today. Okay, great. So thank you. Thank you so much for being interested and being here. So now I switch back to my slide. Let's dive into where this all began. How did infodemic become a whole division at headquarters at WHO? So just as the pandemic was emerging, Dr. Tedros Ghebreyesus, the DG of WHO, announced that we're not just fighting an epidemic, but an infodemic. And this was fueled by never before seen and access to social media in the virtual world. And I was impacted by the noise that was happening. And curiosity led me to the infodemic team and community. So some of you might be wondering, what is an infodemic? So here at the first point, you can read, infodemic is an overabundance of information, including mis and disinformation that surges during an acute health event. But it's actually more than just the mis and disinfo. And you see here on the diagram that it's also questions and concerns that people have and information voids where research just hasn't been able to fill that gap. And so in yellow, you should see a very slight yellow line here where health systems have more influence in addressing these rather than addressing the mis and disinformation, even though that there will be strategies which I'll introduce, but it's where you focus is important. Isolated and vulnerable populations are particularly susceptible to mis and disinformation. And so as public health professionals, we need to get agile in how we respond. Now, you might also be wondering, well, is it a big enough deal to worry about it? And actually it is. And while this is just one piece of information, a report which was published April of this year by the Public Good News, which the author I'll talk about later in this presentation. But this report actually did a social listening exercise, and over 70% of vaccine opposition originates from the US based on this report. Other English-speaking countries followed, like Canada, the UK, Australia, and India. So these top 5 countries make up 90% of vaccine opposition content during this time. And vaccine misinformation trends are getting worse. So within the report, of the top 20 key social media accounts driving online vaccine opposition, the authors predominantly or disproportionately are health professionals and journalists. So again, of those 20, 11 were US links and 6 were Canadian links. So it is actually quite a big approach. And this is why the document is called "The Call is Coming from Inside the House," referring to horror movies, which I don't watch, but it's that phone call that rings in the house, which is referring to that. So what is then the cost of this quite large impact that social media has? So during the pandemic, COVID-19 vaccine misinformation and disinformation cost an estimate of $50 to $300 million each day. And 87% of Facebook, which is now called Meta, budget relate to identifying and addressing misinformation was dedicated for US compared to 13% for the rest of the world. Now, there is a new report out called the Fault Line Report, which is a Canadian focused report addressing the cost of the pandemic. And it identified approximately 2.3 million vaccine hesitant Canadians. And that, while it may seem like a small size compared to the total population, it's quite a significant number, because while it had a $300 million of additional hospital and ICU expenses, there were larger societal impacts, which you will see as I will mention later on. And of course, now we need to consider AI, so large language models such as GPT-4 in the mix, and how does that impact us as a society? So just a little bit about how the infodemic division evolved during the pandemic. It's a busy slide. What's important to recognize is that there were mandates put in place to strengthen the WHO preparedness for and response to health emergencies. And there were 132 signatories across regional statements on infodemic in the context of COVID-19. And so the programmatic response, which was around building a framework and strategy for action, building and mapping out gaps in science that needed to be addressed, using country-based tools and partnerships in doing social listening and insight reporting, which we'll all talk about. And of course, my interest is around the professionalization of infodemic management, particularly with this course addressing vaccine programming and applying the WHO's framework to that. The WHO also came out with a policy brief where they highlight several things, but the most important one, which is around training healthcare workers. As the most trusted source of health information, they need to have the skills and capacity to address their clients, their communities, and society at large. They also recommended tailoring health information and digital literacy initiatives, strive to develop high quality and accessible information, which Canada is great at doing, and establishing an infodemic workforce and rapid info recite generation. So here we start to learn about the physical and the virtual space, which I'll explain in the next slide. So if you take away anything from today, I think this is the most important slide, and the next one. Infodemic management is driven by the use of evidence-based information and anchored in the principles of community involvement. If you're doing any type of similar skills like social listening for other than supporting your community involvement, it is no longer infodemic management. So it has to be principled within community involvement to better community and individual approaches to mis and disinformation. So you have the information ecological framework, where you see that there's the science of infodemiology, the interventions which are taking place in the physical and the virtual world, and of course the impact on behavior change and epidemic risk mitigation. And just the visual, like what is a physical world versus a virtual world? Here I'm trying to, demonstrate with healthcare spaces, dinner tables, and society at large responses. So those are your physical world, whereas your virtual is around how groups and communities form around narratives and dialogues. This is very briefly. Now, focusing on the infodemic management competency framework, which now has been simplified thanks to a newly published book on managing infodemics in the 21st century, with Tina, Tim, and Sylvie's as editors and collaborators writing within the chapters. But basically, this framework is the basis for building the vaccine course, which I'll go through the modules, but to recognize that there's a transdisciplinary approach in each of these areas. And we have tried to bring together Canadian context-specific information and resources across this framework. So again, important slide, I think sort of like the final takeaway is infodemic management is a public health practice, which must be embedded into the health system structures. So when we look at vaccine programming, the physical and virtual world, taking those intervention objectives, like listening to the concerns, communicating risks and distilling science, promoting resilience to misinformation, and engage and empower communities. So that whole of society approach matters to how we show up to vaccine programming and beyond. Okay, so jumping into the first module, which is quite superficial, but what it's trying to do is do a self-reflective activity around vaccine programming during and post-pandemic, start introducing you to terminologies on infodemic management. I won't have the time to do that today, but it started to build up your language and vocabulary. It talks about a vision to transform Canada's public health system, which was a report published, I believe quite recently, or just end of last year. Tools and competency frameworks that currently exist in Canada around immunization programming, how addressing trust and vaccine inequity from a systems lens, and building resilience post-COVID-19 in vaccine programming and beyond. So that's sort of the first module that gets you into infodemic management within vaccine programming. So just to take a snippet, most of our goals around vaccine programming is getting vaccines into arms. That's what we want to accomplish. However, then we need to also build a vaccine demand from a confident public and society and staff who are delivering this program by a trusted healthcare system. So here you have a hyperlinked resource around vaccination and trust and how that happens. And then you add the pandemic to it. And so what happened the direct impact of infodemic, where we saw that morbidity and mortality, so misinformation did relate to morbidities and mortalities. People died of misinformation, of reading misinformation and acting on it. Misunderstandings of health recommendations and behaviors to adapt was taken up by noise and confusion. Mistrust was fueled as a result, whether it be in government, in science, and expert and public health authorities. It hindered previous pre-pandemic accomplishments and fueled stigma, which then resulted in social breakdown of social cohesion. So we have to be aware of these things, that infodemic and mis and disinformation impacts us at a societal level. And some people have referred to information as a social determinant of health. So moving on to module 2, this is where the competencies around social listening and infodemic insight reporting to understand public and peer questions, conserved narratives, and misinformation around vaccines and vaccine programming. So this is all relating back to vaccine programming. So the learning objectives of module 1 is to listen and understand target populations, information voids, needs, concerns, challenges, and develop more responsive health programs. So we need to be agile and responsive. Utilize social listening tools and methods, not just online, but offline. So we need to have an integrated understanding on what's happening and who our vulnerable populations are. Classify and analyze data into identifying information voids and inputs, and we'll talk more about that in module 2. Learn the process of gathering community insights, know how to choose data collection methods, and learn when to find guidance and resources for diagnosing vaccine demand challenges. So it's a lot. The module has lots of incredible resources. It's almost like an encyclopedia of collected information. But just to show you that it also gives you quick tips. So it tells you what the latest evidence is on what to act and implement. But for instance, filling information voids is more useful than chasing rumors. And some have referred to as playing, whack-a-mole with misinformation, trying to keep it under wraps. So remember in the beginning when I told you answering questions, concerns, information voids is where health systems thrive rather than focusing on that, even though I'll show you there is new science around addressing misinformation. So data collection, making sure that it's online and offline. Dashboards are sexy, but they're not perfect. So we need to recognize that. Anytime doing analysis, there needs to be standards of practice so people can refer back to what was done. But that doesn't mean we are not agile and we can adapt to what needs to happen moving forward. So you need to evaluate all that's being implemented. I'll demonstrate a threat matrix just coming up, but understanding what information and narratives are trending up, trending down, re-emerging. So what needs to be addressed for people? And of course, what are the pain points of the community members and their dialogues? Community has to be the heart of everything we do. We as public health and professionals. So busy slides, but it's just to give you a bird's eye view on what a social listening and insight report could look like. And so where you have your threat matrix and you define it by labels, but opportunities for action and filling information voids. This is where you could talk about, or you can set your SOPs based on emerging issues, persistent issues, re-emerging issues, what are the top questions, weekly overviews, et cetera, et cetera. So this is one example that was implemented and used during the pandemic, which kept me sane and cut through the noise to understand what was exactly happening and discussed in real life. So just last week, the WHO and UNICEF collaboratively built an incredible document with templates to build insight reports in 6 steps. And so I'll let you read that and have a look. Some of you might already have experiences doing this, and you have further resources. So this is just something to add to your toolbox. All right. Now, module 2 tries to bring together, again, an encyclopedia of high quality health information and programming for vaccines and immunizations in Canada. So we go from everything from federal level resources and high quality information to provincial, territorial, to various courses to upskill and cross-train, and also international focused resources. So this is where you come for high quality. And this is not only for those of us who are familiar with vaccine programming, but also those of us who are entering into it. So it's a one-stop shop for identifying high quality resources and how to generate vaccine demand beyond just offering communication resources. Describe the Canadian immunization system and available resources, which I just said, best practices for providing fast, accurate, and trusted information to the public and healthcare staff, and learn about trusted organizations that offer accurate vaccine communication resources and immunization competency training, which brings me to Canadian immunization competency training. It does exist. It may need to be a bit updated, but let alone it's there. If you haven't heard of it, it's documented in this module. So it does do a very, tries to be a very thorough resource for those of you who need one place to find everything. And so again, diving into module 2, it does expose you to some of the, I guess, public health approaches that have been used and might be a bit outdated, or we need to innovate around it. So, you know, again, another metaphor that people use is when you have a hammer, everything seems like a nail. And so the deficit model for communication is flawed. We've seen this during the pandemic. You can only tell people facts for so long. Action may not follow, and in fact, it might actually backfire. So when learning new information, there's a science to it. We know that people need to want to learn, and to want to learn, it means that they're ready to invest energy. Like yourselves, you all came today investing energy to learn about this topic. So we need to understand and find ways to encourage people to engage with new material. I mean, some of you came because of work, so I understand that your motivation was guided. However, trusted communication is tailored to individual and community needs and is the more attractive choice to have. So again, community needs to be at the table guiding solutions. It's a co-created process. Again, reiterating with visuals, right? This is using a hammer, sender, receiver, right? I know something you don't know. If you knew it, you would improve your behavior. We need to shift. We need to have a paradigm shift where we collaborate in developing resources and communication plans with community in mind. Okay. So I know I'm trucking through a little bit here, but again, this is just an overview on what the modules offer. And they offer a lot of information. You would say a bit of overload of information. All right. So module 3 is a bit tricky because I wanted to capture that these 3 steps is not only circular, but it's constantly iterative. So delivering high quality health information and programming, whether it be in vaccine programming or other public health programming, is constantly evolving, and we need to implement new evidence and evaluate it. So in part 3A, the module describes how do you apply interventions, tools, and methods in order to build new interventions with your community once you know what their concerns are. So it's an innovative process. Countering mis and disinformation using current evidence, which I'll give you a bit of information on that. And then monitoring information environments and responses. When we're doing implementation, we need to understand what impact does it have and how we can adjust it based on what's needed for the communities. So module A is really just how can you use innovative tools that are already available to you. So using a socio-ecologic model, so going from policy level to frontline to patient, building vaccine demand and uptake, so making it stick, so to speak, at the public policy level, within community, within an organization like a health facility, interpersonal, so how healthcare professionals communicate with individuals, and of course among individuals, what behaviors and practices you need to have in the physical and virtual world. Again, there are intervention categories that are out there that you could select from, policy categories that are, again, right there like a lexicon. And of course, there's a couple slides in the module which introduces human-centered design in public health and systems design approaches. And of course, foresight is another tool where you look at patterns, looking back in order to move forward. These are just tools that we can use to build new high-quality, innovative solutions. So the information environment is complex and it's cross-cutting. And this is why some folks have referred to information as a social determinant of health. But what I would like to demonstrate next is a systems approach to immunization programming. So when you look at this approach, this is actually by the UNICEF Human-Centered for Design for Health. They've come up with systems design for journey mapping health and immunization through where the leverage points are, where trust needs to be built and rebuilt and maintained. And so if you look at sort of the right side of the infinity sign, point 4, 5, and 6, most of us are familiar with this area because it's the clinical, the facility where individuals come to receive their health or vaccines, the point of contact where vaccine care happens, and then the after service. So here you need to build and rebuild trust, trauma-informed clinic spaces, motivational interviewing between client and patient, between medical staff and patients, and of course, aftercare service. But what the system designs allows us to do is actually understand people's worlds even before they want to seek vaccines, before they actually show up to the health service. So their knowledge, awareness, and beliefs around vaccines are equally important. And their intent, remember I talked about not using a hammer and understanding where people want to invest energy. This is the place where we look at who's on the vaccine hesitancy spectrum, how can we get them into vaccine demand, and of course, getting to a facility. So in the physical world, how do people have access to health services and where vaccines are provided? So this is looking at a systems approach and where these points are to leverage building trust and getting community engaged. So I just absolutely love this example. Now, module 3B is another nuanced section around addressing and countering mis and disinformation. So this is some of the sort of nuanced places where science is evolving. And I'm also part of a research group, which I'll talk about, but it's basically offers corrections in a timely way, in formats and through channels that match how the misinformation is spread and promote credibility and trust in health authorities and service deliveries. Health authorities still has a very important place to play to address societal responses in whether it be a public health emergency or routine programming. Building network of stakeholders to share information and improve reporting process, developing and utilizing SOPs for collecting, analyzing, understanding misinformations and levels that are out there, and then tracking misinformation and fact-checking trends over time. This is where your insight report can be extremely handy. So just briefly, module 3B goes into what an infodemic wave is, what are the impacts of misinformation, which I've sort of introduced to you in the introduction, the types of misinfos, what motivates the spread of it, which will be important when we're thinking upstream, tools countering misinfo, and practical actions for countering mis and disinformation. Here you see an example on the slide. It's Cochrane Review in collaboration with Lifology and using graphic designers to speak science communication. And it's incredible. The cartoon, highly recommend it. I'll show you another one later in this talk, but it's an incredible, powerful tool to use these kind of graphic images to get scientific messages across, not just for public, but also for healthcare professionals. Another example of addressing mis and disinformation through inoculation theory, which is called social inoculation. So this is where we get into the ideas of exposure of a weakened form of misinformation builds immunity against later misinformation consumption. So it's really taking from immunizations as a vaccine to psychological inoculation, or teaching people what biases are, what they look, what's a red herring, what's scapegoating, and things like that. And when they recognize it, then when they're taught what they are, then they're able to recognize it in messaging from different agendas. And so there's also, pre-bunking and debunking. There's also there's also a method called truth sandwich. It's all in the course. You just have to click through the slides and it explains what that is. What I do want to highlight is on the left side, this video. It's called Inoculation Science. You can just Google them. It's out of Bristol and Cambridge. And so they've built actual videos to teach you what a biasee looks like. What's a red herring? What's scapegoating? And so these videos teach people what to look for, and they're quite funny. I never watched South Park, but they actually use a section of South Park, I think, where they sing Blame Canada or something. It's funny and it's informative. So it's, again, another tool that's being implemented. Practical actions for countering misinformation, very similar to building innovative solutions, where you take a socio-ecological stance, where you not only do infodemic landscape analysis, but what's useful and supportive at the national level, at the health facility level, and at the community level. So I'll just leave it at that. And then, of course, as I mentioned to you, the whole infodemic capacity building in infodemic management is around training healthcare professionals. And so this is just an article that talks about how healthcare providers, as the most trusted folks, have actual responsibility in countering, debunking, applying their skills of countering misinformation. But I do want to pause and take a second to address, well, during the pandemic, we actually saw quite a large vaccine hesitancy among healthcare providers and professionals. And so it is understandable if there are questions and concerns and narratives are not being answered. And so this is where JitsuVax comes in. So this is an 2020 Horizon EU-funded research study across 7 or so institutions. And they're looking at, it's called Jiu-Jitsu with misinformation. So Jiu-Jitsu is basically using the person's strength in order to, and of course, I'm not going to explain it correctly, but it's basically using a person's strength sort of against themselves. So it's around using individuals' argumentations or psychological stance or reasons against vaccinations and offering them correct and accurate information. It's called empathetic reputational interviewing. There's new studies that are out just today, actually, they're in press. So you can read more about this as well. And I am actually a research assistant, which looks at comparing motivational interviewing and empathetic reputational interviewing. But I'll stop there. It's a fantastic resource. I use it all the time with my students and anyone who asks. And then last but not least, because I'm a clinician at heart, I immediately draw lines between what infodemic managers and the community's talking about in training and upskilling to what we do in the clinic. So you might be familiar with 5 rights, 8 rights, 12 rights of medical administration, making sure that people get the right medication, right dose at the right time, et cetera, et cetera. So when it comes to best practices in information sharing, according to Dr. Barbara Reynolds, it's the right message at the right time from the right person can save lives. And so this is where we need to target our focus, our research, our community collaboration efforts in order to deliver these messages and motivate folks to act to protect their health. So again, this is all covered within module 3B. And then lastly, and I know time is running out, so I'll just speed up. Module C gives you short-term, long-term, medium-term evaluation strategies, because you want to understand impact when you're implementing old approaches, new approaches, adapted approaches. So it's around evaluations, understanding the impact, and developing recommendations for improvement. That's what we do as public health professionals, hopefully, and continuing to do so. And finally, module 4 is really focusing around this step right here, which is promoting and supporting resilience, healthy behaviors, and community engagement. But it also outlines some of the systemic approaches around building infodemic management at a systems level. So I think it's a briefer section, but it's very, very important. And it gives you tools on collaborating with your community. So I think it's quite important. Okay, and so just noticing time, I'm gonna zoom through these last few slides. I do want to talk about what the WHO community, infodemic community, is doing with allies and collaborating centers around building a global curriculum of infodemic management and generalist as well as specialist in various areas. At the same time, they also released free courses where you can upskill. So the Infodemic Management 101 course, which has over 20,000 participants already. It's free to take and you get the basics. What I told you without focusing on vaccine is just general infodemic skills. But they've also released others and more is coming. So this is a channel I highly recommend to keep an eye on. And of course, what changed my personal and professional sort of paradigm shift in public health was this, the simulation-based CIMEX course. And I see there's lots of chats. Do I need to pause?
No, you can keep on going. Well,
so yeah. I really want to explain this because I was enrolled in a simulation training course for nurse educators. And at the same time, I was enrolled in the CIMEX, learning about infodemic management and applying the skill set in a simulated environment. So the WHO team has trained over 1,500 certified IM folks, which are now called unicorns. Our teams were asynchronously solving problems using nothing but WhatsApp, Zoom calls, and shared documents. And so there were 16 or 15 time zones at times, and you would wake up and then people would solve certain things, and then you have to select what you solve. But it was simulating a pandemic, and it was simulating a transdisciplinary approach, which was just incredible. So I believe that the WHO team has demonstrated that the impossible can be done, and the culture can be changed just with the right example and leadership. So their EDI principles were baked into the sim. And so it really, this sim that reignited my passion for public health, hands down, because I was ready to walk away. So just to demonstrate what AI can do to help you build a sim, but at the end of the day, the secret is in the human delivery. So you could use AI to actually build your virtual worlds. And I've never played Dungeons and Dragons, but I'm told it's very similar. However, I've been in this simulation. This was the third cohort in the Republic of Wisdom. And, you know, life happens in Wisdom and we need to respond in a transdisciplinary way. And so in 4 weeks, that's what we did. And so it is incredible what you can do and build a community if you use the tools that are available, but it stays as a human delivered exercise. And again, the WHO is coming out with collaborative brand new publications on operational framework for demand promotion. This is integrating COVID-19 vaccination and routine immunization. But just to reiterate that the final decision remains at the community level. It's just so incredibly important if we want that trust and we want that social cohesion to be maintained. Okay, and I really have to point out Dr. Claire Wardle, who is not only an information guru, but she's the co-founder of the Brown Information Futures Lab, where she actually says, okay, guys, it's really exciting to do fact checking and to, use new science to address mis and disinformation, but we need to take time out. And she says here, an obsession with gauging accuracy of individual posts is misguided. To strengthen information ecosystem, focus on the narratives and why people share what they do. She's actually asking us to sort of look up from the microscope of mis and disinformation and sort of, when people fall into the streams, why are people falling into the river? We need to start looking upstreams and start to address those societal, those structural issues that might be underlying the reasons why people share mis and disinformation. So I think this is the heart of what we do as public health and healthcare professionals. And so lastly, I promise you 2 more slides. So today is Nelson Mandela Day. And I don't know if it's a coincidence or fate, but this post or this quote has been in all of my offices, whether I was in Ontario or the Yukon or Nunavut or South Africa or Australia, this quote has always been following me. And so if you know Nelson Mandela's story, he was actually jailed for 20 years for speaking against the South African apartheid. And so when he received his freedom, and he's saying in his book, if he did not leave his sorrows at the jail doorstep, he would forever remain imprisoned by those feelings. And so he left the prison, he became a free man and forgave for all that he endured. And I think it's really important for public health professionals and across public sectors to really recognize that, yes, we've experienced moral injury, probably before the pandemic, during the pandemic, but we need to come out as engaged with our communities, listening to our communities and understanding what they're asking for and what their concerns are. And so leave you with this quote, which is actually Dr. Joe Smears, who released the Public Good News Report, which I demonstrated early on. And he just did a LinkedIn post with, I think, completely sums up that we need to spend time with the people that our programs are serving. Talk about what they want to talk about. The public hasn't left us really as government and public servants. They think we left them. So it's just really important. And I'm getting all emotional, but I do have one more Slido question, and I don't know if people are still around. So let's see if I can just stop sharing, because I do want to know what would be your smallest unit of action that you take with you after this talk. So if I could just find my Slido. Okay, so poll 3. So what is your smallest unit of action after leaving today, knowing that I've just overwhelmed you with information? And then I'm happy to stick around for questions. The CPA education, awesome. Listen, learn, check out the course. CANVax, incredible team. Module, yep. Info voids, yes. Just keep swimming, love it. Yes, check out the course, hearing, yeah. And please connect with me. I'm here to collaborate. I'm here to support you in any way. I'm no longer leaving public health, so I'm sticking around. And infodemic management is probably the most fulfilling sort of work that I do now. Frontline advocacy. Oh, this is great. This is so great. Okay, so Antonella, what do I do next?
Oh, well, thank you so much, Renata, for presenting a very insightful presentation on the course. I strongly recommend our participants and attendees to check it out. So at this point, if any attendees have any questions, you can please insert them in the chat, in the Q&A. So actually we have 2 questions that are similar or the same. How long will each module take to complete? Are 2 questions from 2 folks that asked this question.
Yeah. Okay, so what I forgot to mention is actually during emergency response, there's sort of 6 points to keep in mind. And the first 3 is be first, be right, and be credible. And I added iterate as needed. So this course is actually a huge purging of information of Canadian immunization content, guidance documents, resources, training, and also internationally. So the modules themselves take as long as you have the attention capacity. It could take a couple hours. It's just click through PowerPoint slides. There's a couple of fact checking at the end of a module just to see what you retained. But really, it's quite simple. It's just clicking through, getting information, and it's just where to find resources. So it could take a couple hours. It could take longer.
All right. And is there an average that you've heard so far from folks who completed the course?
Good question. So some of my colleagues who have completed it said that it's quite long. So I don't know what that means in numeric numbers. Again, it's a lot of content in slides. If I tell you there's 108 slides in total, if that gives you any indication.
Okay, perfect. Thank you. Another question we have is how does the course deal with narrowing down all the information, which is perhaps as much as a problem as mis, dis, and mal information?
Yeah. So how does it narrow down? Good question. So this is not a course to be like, this is the silver bullet and I'm only going to use a hammer. This is a course that introduces you to hammers and screwdrivers and nails and screws and all sorts of tools that you can use. What the WHO team, infodemic team and community refer to is like having a bicycle versus a 4x4 versus a luxury SUV. So based on your public health unit resource, based on your federal or provincial team resource, based on your community not-for-profit organization resource, you could use a bicycle and still try to accomplish little bits of each of the modules that I demonstrated. If you have a luxury SUV, then of course you're going to have, super awesome, dashboards for mis and disinformation, listening, concerns to narratives, things like that. So it's really, do you have resources for a bicycle, a 4x4, or a luxury SUV? And that decides how well you can spread out and hire staff, because you need staff to deliver on each of those tools that I demonstrated.
All right, great. Thank you for that. This is, I just answered another question. I just typed it in for viewers. Somebody asked, do you have the link to the course? So I just typed that into the answer box. We'll also be sending a recording to all registrants, and it'll also be live, and I will also put the link in the oh my goodness, I can't talk today. Okay. I will also put the link in the description of the recorded webinar. The final I guess question, not really a question, but just a comment. Thank you for your passion on this, Renata. Greatly enjoyed this presentation and the information and resources you have provided.
Awesome.
So thank you. And I just, given that it's, 2 minutes to 2 p.m. Eastern, I have one question for you, and it's kind of more like an elevator pitch, but what do you think makes this course stand out from all the other infodemic courses? If you have just a few words to sum up, why the viewers in this webinar should take this course, because there's a lot of courses on misinformation, disinformation, infodemic, but what makes your course stand out?
Oh, good question. And you know what? Take all of them. That's what I would say, is because you'll learn from any of the courses. The WHO 101, the WHO Infodemic Management 101 is the crux of it. Like, that's where I refer to when I forget my skills. So it's a must. And the WHO team with, the book publications and resources. What the CPHA course offers are examples and applications to vaccine programming. So I have been in vaccine programming for 15 years. So this is my nerdy jam. Anything about vaccines, I like and enjoy and talk about. So for me, it's providing applicable examples to vaccine programming. If you are talking planetary health, if you're talking tuberculosis or you're talking non-communicable diseases, then it might be your jam to then apply these same tools and skills. So again, the CANVax is very vaccine and vaccine preventable diseases focused.
Okay, awesome. Thank you so much for that, Renata. And given that it is 2 p.m., I would like to thank everybody for joining us on today's webinar. Thank you again, Renata, for your wonderful presentation. As a quick reminder, please don't forget to fill out the survey upon closing the webinar window device. And we look forward to hearing your feedback so we can see if there's any improvements and suggestions that you have. So thank you, everyone. Thank you, Renata, and have a wonderful afternoon. Goodbye.